So this is the second video in the series of how to really read and research article. In this video, I'm going to walk through an abstract that I read and show you how I apply some of the strategies from the first video. The title is important. Think of it as the abstract of the abstract. So let's take a look at the title. The title says, Prevention of Type 2 Diabetes in Bangladeshis, Qualitative Study of Community, Religious, and Professional Perspectives. Immediately, I'm thinking that this is a qualitative study that includes multiple populations and is focused on the Bangladeshi community. That's very important information already that I got from the title. The next step is to read the objective statement. So let's find it. It's the first thing in the abstract. So the objective statement says, to understand lay beliefs and attitudes, religious teachings, and professional perceptions in relation to diabetes prevention in the Bangladeshi community. So I think it's confirmed that maybe there are three different populations, three different components of the Bangladeshi community, the religious teachings, and the clinician healthcare provider aspect. Now let's move on to the setting and methods. So as I read, I want to note down settings, populations, and methods. So let's look at the setting. So a low-income area in London, UK. Okay, that's good to know. Population, so this is confirmed based on when we read the title. So there's Bangladeshi people, there's religious leaders, and now including Islamic scholars, and now there's also health professionals. Okay, we seem to use focus groups as a data collection method. And for analysis of data, they use thematic analysis using something called a Penn 3 multi-level theoretical framework. Now, I don't know what that is, but it might be relevant information. Now let's take a look at the results. And remember, when you take a look at the results in the abstract, it's a good overview of how the authors have chosen to structure their findings section. But it's still very brief. So let's make important points as we read through the results section. So knowledge was high among the Bangladeshi people that are included in the study. Okay, that's the first point. Second point is, sort of there are barriers that exist at both the practical and the structural levels, and they emphasize cultural norms. Okay, second point. Then the third point is, religious leaders. They did provide religious messages about prevention. Okay. And then the last point I would say is maybe, there's this confusion, misperception amongst clinicians. Now let's shift gears to the discussion and conclusion. So in this case, you can see that the authors have chose to include and merge the discussion and the conclusion into one section, right? And remember, from our previous video, we want to understand and identify the future directions, the implications, and the gaps. The first few sentences might be a reiteration of our findings. So let's take a look. So as I read through, it seems to be that, there is a misunderstanding and there's a tension between clinicians and people. And then they mention that religious teachings are a facilitator. That's an important point too. Okay, so here's an implication. So it seems to be that the authors are suggesting that interventions designed for Caucasian white people cannot be applied to the Bangladeshi community and in fact need to be tailored to the cultural norms, their traditions, and the religion. Okay, and then they talk about future direction. Okay, so they say that there is a need for collaboration between religious leaders and healthcare professionals. And then they end off with another future direction. They say that, then there is a need to improve cultural understanding of healthcare professionals, and specifically cultural understanding of Bangladeshi people and the barriers they face sort of adopting a healthy lifestyle for type 2 diabetes prevention. So we've been through an abstract. We found the most relevant information really quickly. So that's all I have for this video. Feel free to continue on this series as we continue our discussion on the strategies that we can use to read research articles. My name is Umair Majid. I'm from the Methodologist. If you found this video helpful, please let us know. Subscribe to our YouTube channel, like and share these videos with your colleagues and with your friends and your employees. And until next video, take care.